Hello, I just finished my Sunday morning walk rounds. One of my patients is going home today. She had mitral valve repair surgery and has done very well. She had stayed a bit longer in hospital than usual because she developed atrial fibrillation, that is an irregular heartbeat, and needed some medications to get the heart to beat regularly again. So she is now back in what we call sinus rhythm, normal heart rhythm. So she's going home today quite well. Atrial fibrillation does happen after heart surgery. It is fairly common, and it's usually temporary. We can usually give some good medications to get the heart beating normally again. Some patients are at risk of developing atrial fibrillation after heart surgery, and it is more common in patients with mitral regurgitation, because in these patients the left atrium, which is one of the heart chambers, are usually quite enlarged due to the leaking mitral valve over the years. This condition typically causes this left atrial chamber to enlarge, and patients with an enlarged left atrium are at risk of getting atrial fibrillation. Some patients who come for surgery are already in atrial fibrillation when they have their surgery. So in these patients, we would typically do an ablation procedure as well to make the heart go back to its normal sinus rhythm. And we will also close the left atrial appendage. This is a chamber, a small appendage, which is a small chamber or a small addition to the left atrial chamber in which blood clots tend to form, and this can embolize and go elsewhere and cause a stroke, for example. So in patients with atrial fibrillation, we will always close the left atrial appendage at the time of surgery, and also do an ablation procedure to get the heart beating normally again. This particular patient had another risk factor for atrial fibrillation, in that she had hyperthyroidism. That is, her thyroid was overactive. And so in patients with this condition, they are at risk of getting irregular heartbeats and atrial fibrillation. And this, of course, can be treated with appropriate medications. So thank you for listening. I hope that was interesting. I do hope you will have a good day. Please do like and share this video if you found it informative. Thank you.